Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, welcome back. And before the break, we were talking a little bit about thyroid disorders, and I'll probably expand more on that on a later show. But I find it very interesting every time I read a little bit about things. I intend to get some information that even I, who've been practicing medicine for quite a while, didn't really completely understand. But it is very important. One of the things that has a very interesting phenomenon on hypothyroidism later in life is basically a TPO antibodies, and I guess we're gonna. Well, Ray said he was calling back, and he did. Ray.
Yeah, I promised to call back.
Great.
I go to the court every day over on Basin Road, and I pass by the Grove, and I decided I'm going to start stopping in and seeing what this is all about.
Right.
Now, the first time I went in, I was a little upset because I thought Dimitri had said it was an open house, and it really wasn't. But I didn't give up. So I would stop in a second time, and they have like a waiting room. You're not allowed to go into the place where they have the marijuana, but you can be in the waiting room and ask questions of the general manager or whoever, and they come out and they talk to you just like human beings.
Okay.
You can explain problems or ask questions, and they'll tell you what's available if you get the medical use card. Very pleasant people, very polite, and I'm just thinking, I'm saying, you know, if you just want to find out something, you know, you can not go into the Grove per se, but they have this waiting room and they will talk to you. And every question I asked, they answered, and I just can't say anything higher about it. I mean, I'm really impressed.
Good.
So when I drive by, I know all the squad cars are watching for a flagman driving in there. Well, so what? I don't care. I'm going to ask the questions and I'll get the answers. And I would encourage other people, if you're thinking of a medical use card and maybe getting something that would help you out that's not pharmaceutical, that might kill you, just stop in there and ask to talk to one of the, I think they call them bud tenders or bud micers or something like that.
Yeah, bud micers is what
So just want to let you know, you asked earlier any comments on the Grove. It looks like a pretty good place.
That's excellent. That's
all right.
Excellent.
Thank you, Doc.
You're welcome. Yeah, I had someone else, you know, we get a few people that come over from over there, and certainly I think you're right. It's a Budmeister. It's almost like a Brewmeister, but this is a Budmeister, and then they share information on different strains and different things that are out there. And so I think that's, you know, I think that's really good that we actually have that here in town. I think it's good that Nevada has made that rule. There's a couple of things I don't like about it. I don't like the fact that a lot of information about, you know, when you basically, you know, this deal where if you're a marijuana user, it infringes on your Second Amendment right to buy guns. May not be that if you have personal firearms before that. I think that's a federal issue. I find that very distasteful. People can go into alcohol and buy alcohol all day long and go out and purchase a firearm. I mean, I don't get it. They can go get their prescription for Xanax and all the other drugs from your doctor and go right over to any one of the arms store and purchase a firearm. So, but this is the Fed against marijuana. So I don't like the fact that the detection levels are so low. I think that the 10 nanogram detection limit is super, super sensitive, and most people don't realize that use within a week or so are still going to turn up a positive 10 nanogram level. And I think that's almost entrapment in that sense. I think the use, I think 1,000 nanogram test would be probably an appropriate test to look for. Did you just ingest or use marijuana and then get in your car and drive? I had a patient the other day who basically had exceeded the had a very high limit of Xanax in his bloodstream, but they couldn't get him driving under the influence because there was no illegal limit on that. But they actually do have one for marijuana. So I think that's a real crime in its sense. So the user had better beware that while the state is making revenue off of it and you're buying it and you're growing it and you're using it for medicinal terms, it hasn't passed all of the smell tests so that you're basically not going to get yourself in trouble if you do that. And I believe that your driver's license is linked to your medical marijuana card. So if you're driving, they will actually know that you're a medical marijuana user. And that could present its own problem. And for the number of police officers I've seen on the street lately issuing tickets and things of that nature, I think the user had better, the end user had better beware. And these are things that just take time to evolve. And I'm hoping that sooner or later it does. And I think it's a natural product. It's been on this earth for years. It will continue to be on this earth. And I think the government has bigger fish to fry than worrying about people using marijuana for that. So let's see. We have Jane on the phone. Jane.
Yes, I've got a question. You said take that thyroid medicine in the evening at bedtime. I've been taking that in the morning on empty stomach, but I take Coumadin or warfarin at night. Is that gonna? Can I take those both together, the warfarin and the Coumadin? The Coumadin and the levothyroxine.
Yeah, I mean, I think I don't believe there's an interaction between the two. But the key to that is that you're doing it right. But as long as you do take it in the morning and taking it on an empty stomach and making sure that it has a chance to be absorbed into your system is very important. What happens sometimes is we forget that we took our medication and we get a bite to eat because we're doing that, those types of things. So the other thing you could do is take your thyroid medication right before going to bed, your Coumadin maybe a little bit earlier in the evening so that you give it both a chance to absorb. But Coumadin is one of those drugs that you want to take at the same time every day, mainly because of testing and other things of that nature.
Okay, well, thank you.
You're quite welcome. Yeah, so, thyroid does need to be taken on an empty stomach, and so as long as you take it during the morning, that's fine. It's just forgetting that you may have eaten or going to get yourself in trouble may be a problem with that, and then you interfere with this absorption and things of that nature. It's also remembering to take your medication. I mean, that's a big thing, too. I don't believe that the drugs are in the same... The thing that affects a drug is its bioavailability, how much gets absorbed into your system, and when it does, where the food interferes. And the pharmacists usually are supposed to talk to you about that and when to take it. But obviously, in Ray's case earlier, he was given maybe a little bit of bad advice about taking his Levaquin at night. And so if you do get prescribed Levaquin, Avelox, one of those drugs, you want to make sure that you don't take it at night. It will keep you up. Also, if you're taking Levaquin with cortisone, which we see a lot of times in the COPDers in this town, you get a bronchitis, and if you happen to go to, I know this only because I see patients that come back from the urgent care in this town, they always seem to be getting a fair amount of cortisone. High risk of tendon rupture usually Achilles tendons, but can be any one of those tendons from taking cortisone with quinolone antibiotics. So be very, very careful if you're going to be using those two products together. So yeah, thank you very much, Jane, for that call. It's a good point. And some medications are actually taken with food, so in order to aid their absorption. So you want to read your labels as closely as you can, and making sure that you're trying to remember to do that. Pill planners are very helpful for some people, especially if you're busy and you can't remember if you took your medication. When you flip up the tab, you know you took it. When the tab is down, you know you haven't. So the best of memories in the world sometimes get confused in our very busy society, and compliance is the key with a lot of these prescriptions. So anyway, we've covered a lot of topics tonight. I want to expand a little bit more on hypothyroidism. I was talking about TPO antibodies, thyroid peroxidase antibodies, before Ray called in. I'll expand that on another show. But what ends up happening is that over time, your body increases its autoimmune production of thyroid peroxidase antibodies. So what actually you do is you create a situation where your body you need TPO in order to produce thyroid hormone. And when you have antibodies against that, then you tend to get hypothyroidism developing over time. So one of the things we do is we check your TPO antibody, and it's a form of autoimmune problems, but that sometimes can help predict that you will need some other thyroid replacement. And then there's a lot of thyroiditis where you get a lot of toxic goiters and things of that nature. You get exophthalmos, you get heart conditions, you get a lot of hyperthyroid conditions, and they're a little more difficult to treat. Sometimes you have to have surgical ablation, radiation iodine, so probably more than we probably want to cover in this show. And as I said in the beginning of the show, vitamin K is a fat-soluble vitamin. And for people that are taking Coumadin and warfarin, when you eat a salad, it isn't just going to stay with you while you digest that meal. It will stay with you for a longer period of time and alter that INR. And I believe later in this year, they're coming out with antidotes to Xarelto and a few of the other products like Pradaxa, which make them actually safer to take. And I would encourage people to talk to their doctors, as long as the insurance companies will cover it, to get off of the Coumadin and warfarin because of its narrow therapeutic index. And now that they're coming out with antibodies, because vitamin K can be given to you as an antidote for warfarin and correct your clotting parameters like that. That can't happen when you're taking Xarelto. It takes a day for all that interference to go away, but with the new antibodies, they can correct that right away. So anyway, that concludes our show, and I want to thank all of our callers for calling in, and we'll see you here next week. Thank you.